The 15 warning signs of prostate cancer. Most people have no idea how often prostate cancer is diagnosed too late. The scary part is that many early symptoms look completely normal. Men assume it's just aging, stress, or minor urinary changes. But ignoring these early warning signs is exactly why prostate cancer remains one of the most commonly diagnosed cancers in men worldwide. In this video, we'll look at 15 early warning signs you should never overlook. These symptoms can appear weeks, months, or even years before the disease becomes severe. But most men never recognize them. Imagine this. If you understand a few key symptoms today, you'll know whether you're safe or whether you need medical attention. Stay with me until the end, because by the last symptom, you'll be able to say with confidence, "I'm safe," or "I need to get checked." And yes, the last symptom is something 99% of people ignore. That single sign alone is the reason so many prostate cancers are detected late. Before we begin, there's something important you should know. Many of these signs can also appear in other common health conditions. And that's exactly what makes them so dangerous. At the end, I'll show you which combination of symptoms means you should see a doctor immediately. Don't skip that part. We'll break these 15 symptoms into 3 groups. The first 5 are the early signs that look completely normal. And that's precisely why they fool so many people. Symptoms 6 through 10 already suggest something may be progressing. And the last 5 are the critical signs. If you recognize these, you need to act now. Ready? Let's get started. Block 1. Early signs that seem normal. Number 1. Frequent urination at night. You probably never connected this to cancer. And that's exactly why this sign goes unnoticed for years. Waking up multiple times at night to urinate is one of the earliest and most overlooked warning signs of prostate cancer. It may seem harmless at first, but it often means something is interfering with the normal flow of urine. When the prostate begins to enlarge or develop a tumor, it presses against the urethra, the tube that carries urine out of the body, making it harder for the bladder to empty properly. Sometimes it's just one extra bathroom trip. Sometimes it's an urgent urge that wakes a man from sleep, even when the bladder isn't full. Many men ignore this or blame aging, drinking water late, or stress. But prostate-related nocturia has a very different pattern. The urge feels sudden, urgent, and often comes with a weak or interrupted urine stream. It may appear for a few nights and then disappear, which makes it easy to dismiss. But repeated nighttime urination is a sign that the bladder is under pressure and working harder than it should. Over time, the trips become more frequent, sleep is disrupted, and daytime fatigue begins to set in. Regardless of your age or overall health, waking regularly to urinate is not something to ignore. Early evaluation can identify prostate problems at a stage where treatment options are far more effective. The next sign is even easier to ignore, because it seems like nothing more than a hydration issue. But it isn't. Number 2. Weak urine stream. Most men don't even notice the stream has gotten weaker. The change is so gradual, it just seems normal. But it isn't. A weak or slow urine stream can be an early sign that the prostate is affecting how urine leaves the body. Instead of flowing smoothly, urine may come out with reduced force, making it harder to empty the bladder completely. This happens when changes in the prostate narrow the urinary passage, creating resistance during urination. Sometimes the stream simply seems thinner than usual. Other times, it may start strong and then suddenly slow down or stop. Many men ignore this change or assume it's due to dehydration or a temporary bladder issue. But prostate-related urine flow changes follow a different pattern. The stream often lacks pressure and feels difficult to control from the very start. That inconsistency makes it easy to overlook. But a weak stream often means urine is struggling to pass through a restricted area, leaving the bladder partially full after each trip. Over time, urinating takes longer, requires straining, or leaves a lingering feeling that the bladder never fully emptied. Even without pain or discomfort, it signals that something may be interfering with normal prostate function. Pay close attention to the next sign, because it's one men talk about the least, but it can reveal a great deal about what's happening inside the prostate. Number 3. Painful ejaculation. This is the symptom almost no man brings up with his doctor. Out of embarrassment, assuming it will pass, or simply not imagining it could be related to the prostate. But it can be. Painful ejaculation can be an early sign that something is affecting the prostate. The prostate plays a key role during ejaculation, producing fluid and helping move semen smoothly through the reproductive tract. When changes begin to occur, inflammation, pressure, or abnormal tissue growth can interfere with the nerves and muscles involved. As a result, some men begin to notice discomfort, pressure, or sharp pain during or immediately after ejaculation. A deep sensation in the pelvis, behind the pubic bone, or near the lower abdomen. At first, this pain may appear only occasionally, making it easy to dismiss. Over time, the discomfort can create hesitation and anxiety around sexual activity, affecting both physical comfort and overall well-being. This is not just a temporary sexual issue. It can be the prostate's way of signaling that something deeper is affecting its structure or function. The next sign is the one that frightens people most when it appears, and the one most ignored when it disappears. Don't make that mistake. Number 4. Blood in the urine or semen. It appeared once, you got worried, then it was gone, and you felt relieved. That is exactly the pattern that makes this sign so dangerous. Blood in the urine or semen is a serious warning sign that many men overlook or assume is harmless. The prostate sits close to the bladder, urethra, and reproductive ducts, all surrounded by tiny fragile blood vessels. When abnormal changes begin inside the prostate, a growing tumor or inflammation can place pressure on nearby tissues, causing small blood vessels to rupture. In the early stages, the amount of blood may be very small, a pink, brown, or rusty color in urine, or faint red streaks in semen. Sometimes the change appears only once, which makes it easy to dismiss. But blood from the prostate does not appear without a reason. Over time, the bleeding may return more often or become more noticeable. When it appears, even briefly, it is the body's way of signaling that something inside may be damaged or under stress. Early recognition of this symptom can be critical. Identifying the problem at this stage dramatically increases the chances of successful treatment. If you've already identified any of these first 4 signs, pay even closer attention to what comes next. The following symptoms suggest the problem may be progressing, and the sooner you know, the better. Number 5. Numbness or weakness in the legs and feet. Your legs feel heavy, there's a tingling that won't go away, or a weakness you can't explain. Many blame it on circulation, but it could be something more serious. When prostate cancer spreads to the spine, it can compress the nerves that control the legs. This causes numbness, tingling, or weakness, which may start on one side and spread. The sign is often ignored because it seems far removed from the prostate. But nerves compressed by a tumor don't resolve with rest or massage. Over time, the weakness can limit mobility, make walking difficult, and affect balance. When this symptom appears alongside back or hip pain, it signals that the cancer may be advancing. Immediate medical evaluation can prevent permanent neurological damage. The next symptom is the most surprising, because it looks like a common digestive problem, but the prostate is closer to the bowel than most people realize. Block 2. Signs that something may be progressing. Number 6. Pelvic discomfort. This is the symptom people most often confuse with something else, and that's why they spend months without investigating the real cause. Pelvic discomfort is a subtle but important symptom. The pelvic region contains vital organs, nerves, muscles, and blood vessels that work together to support urination, bowel movements, and reproductive functions. When a tumor begins developing in this area, it can press against nearby tissues, irritate nerves, or interfere with normal organ movement, creating a vague sense of heaviness, tension, or pressure that doesn't go away easily. At first, the discomfort may feel mild. Many people attribute it to sitting too long, muscle tension, digestive issues, or stress. But unlike temporary discomfort, cancer-related pelvic pain tends to become more noticeable over time. As the tumor grows, it can increase pressure on the bladder, rectum, or pelvic floor muscles. Pelvic discomfort that lasts for weeks, keeps coming back, or gradually intensifies is the body's way of signaling that something inside the pelvis may not be functioning normally. The next symptom seems too small a detail to worry about, but it's exactly that feeling of, "it's nothing," that causes so many people to delay seeking help. Number 7. Incomplete bladder emptying. You finish urinating, stand up, and seconds later feel like you need to go back. That's not normal, and it's not your age to blame. Feeling like the bladder hasn't fully emptied after urinating is an important warning sign. The prostate sits just below the bladder and surrounds the urethra. When a tumor begins to grow in the prostate, it can press on or narrow this tube, blocking the free flow of urine. Sometimes it's just a mild residual pressure, the feeling of needing to go again right after finishing, or the urge to strain slightly to empty more. Many people ignore this or assume it's aging, dehydration, or stress. But that repeated urge happens because residual urine remains in the bladder, sending signals that it's still full. As the condition progresses, incomplete emptying can become more noticeable and uncomfortable. The bladder may stretch or weaken from constantly holding residual urine, increasing the risk of infections and further urinary problems. The bladder is designed to empty efficiently. When it doesn't, it often means there is an obstruction along the way. The next symptom is the one that surprises doctors most, because most men never imagine it could be connected to the prostate. Number 8. Erectile difficulties. Many men spend years blaming stress or age, never imagining the problem could be in the prostate, and that delay in diagnosis can come at a high cost. Erectile difficulties can be an early sign that something is affecting the prostate and the systems connected to sexual function. An erection depends on healthy nerves, proper blood flow, and smooth communication between the brain and the pelvic organs. The prostate sits close to the nerves and blood vessels that control erections. When abnormal growth or pressure develops in this area, it can quietly interfere with these pathways. Signals from the brain may not travel as clearly, and blood flow may not respond the way it normally should. At first, the change can be subtle. Erections feel weaker than before, take longer to develop, or don't last as long as they used to. What once happened naturally may start to require more effort or concentration. As this interference continues, erectile problems can become more consistent. Over time, these changes can affect confidence and intimacy, adding emotional stress to the physical symptom. This isn't just a temporary performance issue. It can be the body's way of signaling that something deeper is affecting the prostate and nearby nerves. Most people who feel this assume it's a simple infection and wait for it to pass. Sometimes it does, but other times, the problem is more serious than it looks. Number 9. Burning or pain when urinating. Most people who experience this assume it's a simple infection and wait for it to pass. Sometimes it does, but other times, the problem is more serious than it appears. Painful or burning urination can be an important warning sign that something may be wrong in the prostate or urinary system. The urinary tract is lined with sensitive tissues that allow urine to flow smoothly when everything is healthy. But when abnormal growth or inflammation begins near the prostate, it can disturb this delicate lining, creating a burning or stinging sensation during urination. At first, the discomfort may feel mild, a slight burning at the start or end of urination, or a brief, sharp sensation that fades quickly. Because it comes and goes, many people ignore it. Over time, the sensation can become more frequent, last longer, or occur every time you urinate. This happens because the underlying irritation continues, placing repeated stress on the urinary tissues. Pain or burning during urination, especially when it persists, is the body's way of signaling that the urinary pathway may be inflamed, compressed, or damaged. This symptom should never be brushed aside. Now we reach the 10th symptom, and this is the first one that suggests the cancer may have spread beyond the prostate. If you recognize this sign, the next block is especially important for you. Number 10. Lower back, hip, or thigh pain. Have you ever felt a back pain that nothing would fix? That got better for a few days and then came back even stronger? That's not a coincidence. Ongoing pain in the lower back, hips, or upper thighs can be a serious warning sign because it may mean prostate cancer is affecting nearby bones or nerves. When cancer spreads outside the prostate, it often moves into the spine or hip bones, where it weakens bone tissue and irritates surrounding nerves, triggering deep and persistent pain. This pain doesn't always feel alarming. Sometimes it begins as a mild ache, stiffness after rest, or discomfort that feels like a muscle strain or joint problem. Many people blame age, posture, or physical work. But cancer-related pain behaves differently. It does not fully improve with rest, exercise, or common pain medication. It may appear for a few days, disappear, and then come back with greater intensity. As the disease progresses, the pain can spread to both hips, worsen at night, or become sharp enough to limit walking or daily movement. Persistent pain without a clear injury is dangerous. Early testing can identify prostate cancer before serious bone damage occurs, when treatment is far more effective. If you've reached this point and recognized 2 or more symptoms, whether in the first 5 or in this second block, what comes next is critical. The last 5 signs are the most serious, and the 15th is what 99% of people completely ignore. Block 3. Critical signs. If you have these, act now. Number 11. Difficulty starting or stopping urination. It seems like a minor detail, but when urine can't flow properly, what's happening inside your body is far more serious than it looks. Trouble beginning to urinate or stopping the flow can be an important warning sign that prostate cancer is pressing on the urethra. As the prostate grows, it can narrow or partially block this tube, making it harder for urine to pass normally. This problem doesn't appear suddenly. It often starts with hesitation. You feel the urge to go, but need extra time before urine begins to flow. Many people assume it's just aging, stress, or not drinking enough water. But cancer-related blockage develops slowly and keeps worsening. At first, the flow may stop and start, or you may feel unable to control when urination ends. Repeated difficulty means the bladder is working harder to push urine past an obstruction. Over time, the bladder can weaken, leading to longer bathroom trips, straining during urination, or a feeling that the bladder never fully empties. When urine cannot flow adequately, it can back up and cause infections, bladder damage, or kidney problems. The next symptom happens suddenly, without warning, and it's easy to mistake for anxiety or sensitivity. But how often it occurs changes everything. Number 12. Sudden and urgent need to urinate. You don't have time to think. The urge arrives and you have to rush. And when that starts happening frequently, your body is trying to tell you something important. A strong, sudden urge to urinate that comes without warning can be a concerning sign because prostate cancer can disrupt how the bladder and nerves communicate. When cancer affects the prostate, it can irritate nearby nerves or disturb normal bladder signals, causing the bladder to contract suddenly even when it isn't full. At first, you may feel a quick urge that forces you to rush to the bathroom, especially during the day or after small amounts of fluid. Many people think it's caused by caffeine, anxiety, or a sensitive bladder, but cancer-related urgency occurs more frequently and feels harder to control. At first, you may still make it to the bathroom in time, which makes it easy to dismiss. However, these repeated urgent signals mean the bladder is being overstimulated by an abnormal process. As the condition progresses, the urges can become more intense, happen more often, or occur at night, disrupting sleep and daily routines. The risk of losing bladder control increases, and ongoing nerve irritation can weaken bladder function over time. The next three symptoms are different from all the others. They don't just affect the prostate, they affect the entire body. And that's why they are the most dangerous to ignore. Number 13. Unexplained weight loss. You haven't changed your diet. You're not exercising more, but you're losing weight. And deep down, something tells you it shouldn't be happening this way. Losing weight without trying can be a serious warning sign because prostate cancer can quietly alter how the body manages energy, nutrients, and muscle strength. Cancer cells grow aggressively and demand constant fuel, drawing energy from fat and muscle stores, even when a person is eating normally. This process usually starts slowly. At first, you may notice your clothes fitting looser, a drop on the scale, or a slimmer face without any effort. Because the change is gradual, it's easy to ignore or even feel pleased about it. However, unexplained weight loss means the body is under internal pressure, and normal metabolism is being disrupted. As the condition progresses, the body may start losing muscle instead of fat, leading to weakness, reduced stamina, and fatigue that doesn't improve with rest. Unexplained weight loss is dangerous. It often signals that cancer is no longer limited to one area and may be affecting the entire body. And now we reach the 14th sign, the one 99% of people ignore. Pay close attention, because it is the most silent of all and the most telling. Number 14. Persistent fatigue or weakness. You slept well. You rested the whole weekend. But on Monday, you still feel exhausted. That kind of tiredness has no simple explanation, and it should not be ignored. Feeling constantly tired or weak can be a serious warning sign because prostate cancer can interfere with the body's energy production and nutrient use. Cancer cells consume energy rapidly and may affect hormones or blood production, leaving the body struggling to maintain strength and stamina. At first, you may feel unusually tired after simple tasks like climbing stairs, carrying groceries, or completing your normal daily routine. Many people think it's just aging, stress, a busy schedule, or lack of sleep. But cancer-related fatigue is persistent and doesn't improve even with rest or relaxation. This ongoing weakness is the body signaling that something internal is straining normal function, including muscles, nerves, and energy systems. As the condition progresses, fatigue can become more intense, affecting both physical and mental abilities. Simple activities may require extra effort. Concentration may drop, and even getting out of bed can feel exhausting. Persistent weakness is not harmless. It can indicate anemia, hormonal imbalance, or the cancer spreading beyond the prostate. all of which can severely reduce quality of life and physical health. And now we reach the 15th and final sign, the one almost nobody connects to the prostate, but one that can reveal a great deal about the stage of the disease. Number 15. Difficulty emptying the bowel. Something has changed in how your bowel functions. Constipation that wasn't there before, discomfort when passing stool, or a feeling of internal pressure. It seems like a digestive issue, but it may not be. The prostate sits very close to the rectum. When it enlarges or develops a tumor, it can press directly on the bowel, making it harder for stool to pass. This pressure can cause persistent constipation, pain during bowel movements, or the feeling that the bowel never fully empties. At first, the symptom is mild and intermittent, easy to attribute to diet or stress. But when bowel difficulty occurs alongside other urinary or pelvic symptoms, the body is sending a clear signal that something is interfering with the organs in that region. Ignoring that combination can cost precious time in diagnosis. Now you know. And knowing changes everything. If you recognized one or more of these symptoms, even if they seem mild or come and go, please don't ignore them. Prostate cancer often stays silent until it becomes serious, and early detection can make a life-saving difference. Sudden urge to urinate, burning when urinating, erectile difficulties, blood in the urine, unexplained weight loss, pelvic discomfort, fatigue that won't go away. These are not things to overlook. You deserve answers. You deserve peace of mind. So if something doesn't feel right, talk to a healthcare professional. A simple checkup, a scan, or a basic examination can give you clarity and potentially catch a problem before it becomes dangerous. Remember, awareness is the first step. Action is the next. And your health is worth both. If you found this video helpful, share it with someone you care about. You never know who might need this information today. Take care of yourself. Listen to your body, and I'll see you in the next video.